Hello, my friends. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, November 12th, and it is time for another live IT support group meeting. Now, one of the things I love about doing these support group meetings are the people who watch it afterwards. And I want you to know that I really respect your time, and I want to make sure that I'm giving you good, useful information and hope and comfort and education, all that sort of stuff. And so, thank you so much for coming to the IC Network for your news about all things related to IC and bladder and pelvic pain. I'm really delighted to be here, and I really appreciate your trust. Now, I'm the founder of the Interstitial Cystitis Network. I'm the longest serving IC support group leader in the United States, actually in the world now, I think, pretty sure. This is what I do. This is my job. I work with patients every day. Also, through our website, the IC Network, icnetwork.org. I bring to you a lot of experience and skills. I've got several college degrees, including a degree in pharmacology. Hello, Gay. I'm good. How are you? I have a master's degree in psychology. The IC Network was actually my doctoral dissertation proposal of how to bring support to somebody who was homebound, which ironically I could not do because I was homebound. But it's very comforting to know that 30 years later, we're still rated #1 in the world by in 2 peer-reviewed studies, University of London and Children's Hospital Harvard. So we're doing okay. Now, normally when I do these meetings, I have a lot of things that I want to share first for about 30 minutes, and then I'm happy to take your questions. I have a lot to share today. Lots of interesting things happening right now. So so the first thing that I want to talk about is I just updated a clinical trial announcement. Now, what is a clinical trial? A clinical trial is where we are testing new therapies to see if they are good and helpful. And your participation in a clinical trial has several advantages. Number one, it allows you to work with some of the best doctors in the country, if not in the world. Number two, your medical care is free. And number three, you have an opportunity to try new therapies before anybody else. The con of doing a clinical study like this is sometimes it involves a little bit of travel. Sometimes the purpose of a study is they have a placebo group versus a group of patients who are actually getting the medication. That's very, very important because that helps us eliminate the placebo response. So you'll never know what you're going to get at first, but normally at the end of the treatment period, people who've gotten the placebo will be offered the chance to get the actual medication. And we're also wanting to make sure we understand side effects. And so your participation in a clinical trial is a tremendous gift that you're giving to the patients who follow you. I work with a lot of clinical trial companies. I always want to work with clinical trial companies because they represent hope to me. So for those of you who say nothing is happening in the IT research world, I'm going to prove you wrong because I'm going to show you clinical trials that are actually looking for patients right now that are very, 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 very encouraging. So the clinical trial that we're going to talk about right now is a clinical trial that is testing a new method of pain control. And the way they're doing it is with a topical foam. So it is a foam that is inserted into the rectum. And because the nerves in the bladder and the nerves in the bowel are shared, the belief is that by silencing the nerves in the rectum, we're also going to reduce and silence some of the nerves in the bladder. So this is probably, I'm going to say in the last 20 years, the most innovative therapy being studied right now that has the potential of helping tens of thousands, if not millions of patients, not only for IC, but think about those patients who have bladder cancer. Think about those patients who have a severe UTI and they're just struggling with terrible pain, what is wrong with my glass? I have got something on my glass here. Um, the and it also, I think, would also silence the nerves in the bowel. So for those patients with irritable bowel and all that sort of stuff. So the potential for this therapy is really staggering. I'm really very excited that we get to share it with you now. So what I did this week, now we did our first mailing on this in late September to the IC network members. So some people are already participating in the IC group, but there's plenty of room for more. Um, and they finally gave me the list of clinical trial centers. So they're looking for 300 participants. Let me just read this to you. I'm going to read you the formal statement that the company wants me to release. So it's called Working Toward a Life Less Interrupted for People with IC-BPS. Living with IC and bladder pain syndrome can be debilitating, but Ironwood is sponsoring a clinical research study of a new potential treatment that could offer relief. The IC-BPS clinical study will evaluate an investigational foam-based drug to inhibit pain receptors in the colon, which may modify pain in the bladder. Now, many of the 4 to 12 million people in the US with IC may be interested in a new option for pain management as they've been unable to find relief from the discomfort and life interruption associated with IC. And this is why they're conducting this clinical study. Let's see here. This is a phase 2 clinical trial. The study drug is designed to utilize the shared nerve pathways between the colon and the bladder to modify pain signals in the colon, which might also relieve bladder pain associated with IC. They're looking for 300 participants. This is a study of up to 21 weeks. It is given rectally, and there will be 3 groups. 2 groups will be receiving doses of the investigational drug, and 1 group will receive placebo. To participate in the study, you must be between the ages of 18 and 70. You must have been suffering for 6 months or more from chronic bladder pain associated with pain on bladder fill. And you must have experienced at least one of the following symptoms related to IC for 6 months, including nighttime urination, 2 or more times a night, frequent urination during the daytime, more than 8 times per day, and or urgency. So where is this study being done? This study is across the United States. And Julie, I'm not sure if they're in Canada. I can check that for you. So they've got centers in Mobile, Alabama, in Arizona, Scottsdale, and Tucson. In California, it's in Los Angeles, Murrieta, Orange, San Diego, and Vacaville. In the District of Columbia, Washington. In Florida, we have got study centers in Miami, Orlando, Palm Springs, Sunrise, and Tampa. In Georgia, at Cartersville. In Idaho Falls. In Indiana, in Jefferson, Indiana. In Louisiana, in New Orleans. In Massachusetts, in Watertown. In Michigan, at Royal Oak, and in Troy, Michigan. Here, hold that thought, Ashley. In Nebraska, Omaha, Nebraska. In New Jersey, Hackensack, New Jersey. In New Mexico, Albuquerque. In New York, Albany, Garden City, New Hyde Park, New York, in New York City. In North Carolina, at Winston-Salem. In Ohio, at Gahanna, Mayfield Heights, and Zanesville. In Pennsylvania, in Bala-Cynwyd and Reading. In South Carolina, in Charleston. In South Dakota, in Sioux Falls. In Chattanooga, Tennessee. Knoxville, Tennessee. Dallas, Texas. Houston, Texas. Pearland, Texas. Salt Lake City, Vienna, Virginia, and Seattle, Washington. Now, most of those centers are up and running. They are ready to work with you, but about a third of them are not quite there yet. They're still setting it up, but you still definitely want to go visit the website. You can learn more about this at icbpsclinicalstudy.com, icbpsclinicalstudy.com. Or you can go on over to the IC Network website and you'll see a yellow picture right on the front page under research. Click on that and that will take you over to the IC Network website where I've got a lot more information on this. And you can look at the contact centers. You can look at the doctors that are doing it. Well, actually not the doctors. I don't have the PIs here. I got the research centers and I've got the person to contact if you might be interested. Okay. So, and we also are recruiting for another clinical trial that you can also find on the IC network, although I do not have the study centers for that one. And it looks like we're going to be bringing on another clinical trial maybe next month or in early 2024. Okay. Also, in the IC Network Clinical Trial Research Center, I've got some articles on what do clinical trials do, why should you participate, and a wonderful diary about a clinical trial by that was published in the Washington Post by a reporter with IC who actually participated in a clinical trial, and it just kind of shares what it is. So anyway, for those of you who absolutely believe the IC movement is not going anywhere from a research standpoint, you could not be more wrong. And I had a blast talking with the clinical trial coordinator last week, and I'm just staggered by the potential here of how many other conditions this could help. Yeah, and right now they're focusing on IC, but it's going to be very interesting to see where they take this in the future. I'm very, very excited about this study. Now, the next thing I want to talk to you about is something that I put up this week, an article about herpes. So, many years ago, back in 2015, we had an IC patient who reached out to the IC network and said, gee, can an outbreak of genital herpes trigger an IC flare? Well, what a fantastic question. And we simply did not know. So we did a survey on this. And so, and this again, this is 8 years ago. A total of 42 patients diagnosed with IC and genital herpes participated in our survey. 75% reported that they suffered more intense IC flares during a herpes outbreak. 84% reported more bladder pain, 81% reported more bladder pressure, 70% reported more frequency, and 67% reported urgency. Now, the location of the herpes outbreak was absolutely critical, with several patients reporting that an outbreak near the urethra caused more urethral burning and burning during urination and pain. One patient reported that her very first IC flare occurred during a bad genital herpes outbreak when she could not get a hold of her doctor for her normal antiviral meds. She said, quote, I believe the outbreak is internal near my bladder. I get the same herpes symptoms at the beginning. Little urine was expelled, headache, pressure. I even mentioned it to my gynecologist, and I'm so grateful you're doing this survey. I believe there is a connection. And the reason why this came up is this, and why I updated this article on our website is because somebody asked this question again. And I thought, and we have to really clearly understand that, remember, you are an anatomical mystery to be solved. We've got to figure out what the hell is triggering your symptoms. For some of you, it's a muscle problem. For others, it's a nerve problem. For some of you, it's estrogen atrophy. And for a small percentage of you, it could be a funky infection. When I say funky, what do I mean by that? Well, when you think infection, you think bacteria. But you have to stop thinking that, because we all also now have to very clearly look for fungal infections, candida infections, and viral infections. Specifically, we've now linked the Epstein-Barr virus and the polyoma virus to the development of Hunner's lesions in some patients. So anyway, I found a new study in 2020. Researchers in Taiwan sought to determine if there could be a relationship between IC and the herpes zoster virus. So we've got two separate viruses going on. We've got the HSV2, which is genital herpes, and we've got herpes zoster, which is the chickenpox virus that also causes shingles. So in 2020, researchers in Taiwan sought to determine if there could be a relationship between IC and the herpes zoster virus. Herpes zoster is the more common infection associated with sores on the lip, mouth, and tongue, as well as very painful shingles. It is a result of prior chickenpox infection, after which the virus lays dormant for a period of time and then activates, often during periods of high stress. And this, of course, then causes sores. In this study, a total of 1,096 patients with IC and 4,384 controls were enrolled. And the incidence rate of patients with IC who had herpes was 10.8, whereas the controls are 7.2. So what does that mean? It looked like more IC patients than the normal population were struggling with herpes. That herpes zoster risk was 1.48 times that of the control patients. And among patients 49 years or younger, they found an almost twofold increased risk of herpes zoster. These researchers concluded that IC had a high risk of herpes zoster infections, urging physicians to not ignore the potential role of this virus in urinary symptoms. Okay, and then I go over the polyoma viruses. And of course, now we are starting to see studies of antiviral medications for patients where they have found virus. So we are long past the day of assuming that a UTI is a result of bacteria. Both fungal and viral infections have been identified in some, but certainly not all patients, suggesting there is an infection-mediated phenotype in the IC patient population, as Dr. Curtis Nichols suggested earlier this year. It further justifies the use of next-generation DNA urine testing to identify potential infections in those patients who are struggling with long-term bladder symptoms that are not responding to treatment. In other words, we got to rule this out. We need to rule these out because these are potentially treatable. So I have a website that I built several years ago called Bladder Health, bladderhealth.org. That's all about next-generation DNA urine testing. And for those patients, again, who are not responding to therapy, or getting worse rather than better, or for those patients who really believe that this is infection, this is about ruling stuff out. It's data. It's facts. There's no emotionality attached to a next generation DNA urine test. If you want to know what the heck's going on in your urine, have a next generation DNA urine test. Because urine cultures do not grow out fungus and virus. And urine cultures actually don't grow out a lot of bacteria. They miss a lot. So, this comes up a lot. And I'm going to get into that in a moment. Now, the third thing I want to share is the IC Optimist Fall Magazine is done. It is at the printer. I don't have a copy of it yet. I will have it for you next week. It will be on your member pages this week. All right. Now I want to get into something. And hello, Ashley. Hello, Donna. Hello, Rhonda. What's the name of the study? Ashley, go on over to the IC Network website, icnetwork.org. It's on the front page. You can see the title over there. Okay. All right. Now I want to talk about something. Let's take a deep breath in and a deep breath out. Let's do it again. Deep breath in and a deep breath out. I do this a lot now. I'm really trying to pay attention to how I'm feeling. Mary says, I'm 73. Why won't the studies include me? Mary, I think the assumption is that once you're over the age of 70, that there are too many other medical conditions that could be contributing to your pain, and that would dilute the data. So the thing that you've got to, and it would make data analysis very, very complex. But what you really need to carry hope on here is that they're doing it. And if it's good, it's going to be available and you may be able to use it. If the data concludes exactly what I think it's going to conclude, hopefully we will have this on the market sooner rather than later to really help those patients struggling with pain. I mean, that's super, super exciting. Super, super, super exciting. Hello, Renee. Hi, Carol. Hi, Julia. Hello, Gina. Nice to see you. Okay. So I was up at my sister's yesterday. We were at a baby shower. And as I was driving home, something really dawned on me that I wanted to talk to you about. And that is being excluded from events because you have IC. And I want to talk first to family members and friends because I know a lot of family members and friends watch this. So to the family members and friends who are watching this right now, I beg of you to include at every opportunity your family member or friend who has pain, who has IC, who has pelvic pain. There is nothing worse than watching your family get together and your friends get together without you, especially if you tell them. Actually, I have to go back to when I had IBS because I had the IBS before the IC, was so severe. I really could not leave my house. The pain, the cramping was intense. Yeah, Ashley. Ashley says they think it's not real. Exactly. We'll get to that. And something as simple as driving 5 miles to a birthday party, that's an astronomical challenge for somebody who has pain in a car. And guys, I'm not talking about little pain. I'm talking about feeling like you have a razor blade slicing open your bladder or slicing open your bowel. And I feel such joy that I can, after decades, participate in family events. I had multiple reasons why I couldn't. Back when I was in my 20s and 30s, my IC was and my IBS was terrible. It was very hard for me to participate. Sometimes I could, sometimes I couldn't. Sometimes I'd get in the car, get halfway there, the cramping would be really bad. I'd turn around and come home. And during the holidays, it is so much worse because we are a part of your family. We are still your friend. And we are suffering. And we need your love. And we need your support. And we need your patience. We need you to believe us when we say it hurts. We need you to believe us when we say, I can't eat that. If somebody says, hey, would you love to come to Thanksgiving? We're serving ham. And maybe you have an issue with ham. And it becomes a very delicate dance. It is a very delicate dance. And so for the IC patient, what we do is we will just bring food that we can eat. We will work with you ahead of time. We will participate fully as much as we are able to participate. We will eat ahead of time so that we're not that full when we get there, so we can just pick. But please, please don't exclude us. Because when you exclude us, it hurts badly, badly. Now, there are moments when we can't participate, but ask anyway. Tell them that you love us. Tell them that you care. Tell them that you will bring Christmas dinner over to you after the party. There's like two different things that I want to say. I have never cried so hard as when I watched my family drive away, leaving me home. Now, I needed to be home. I could not make that journey. I was invited to speak at my cousin's wedding in San Diego. I could not get there. I could not drive 10 miles, much less 400 miles. And I will tell you, I sobbed for hours. And you know, my mom, I didn't mean to cry today. My mom struggled because she wanted me there and she was really good at trying to guilt me to come, even when I felt bad. She was a master at family. Mom, listen, I know you're here and you know I love you and you know you did this. She was a master at trying to get me to do things when I didn't feel well. She was a master at that. And because she didn't want me to be left behind. And it took a lot of convincing on my part to say, Mom, I have to stay home. And so while I cried, as they drove away, I was so happy to be home. I was so happy that I didn't have to go make nice. I was so happy that I didn't have to explain it to other family members who didn't believe. Oh, what's wrong with Jill now? Aren't you better? No, I'm not better. And so we dance this really delicate dance where, listen, we need to be involved in our families' lives. And when we feel good, please give us that opportunity. And when we don't, give us a hug and love us and love on us and bring some of that celebration to us, right? Does that make sense? Hi, Kayleen. Oh, excellent. So, being left out is a hot button for me because I lived that for decades. And then I lived that because I had to stay home and care for my parents. And so now that I get to participate in things again, it's such a joy to just be with my sister and be with family and to just soak in that love. And I really realize how much I missed for so long. So, the family members and friends that are watching this, don't doubt our pain. Don't doubt our role in the family. Don't doubt our desire to be there, to want to be there, we would do anything to be there. And get us involved. Why not call ahead of time? Why not call ahead of time and say, "Hey, Jill, Christmas is in a couple months. What do you think would work for you?" Or I'm going to tell you to be proactive. You bring it to your house. You don't have to fix a giant meal for your family. You can have a potluck and say, "Hey, everybody, I would absolutely love it if you could come to my house for New Year's. Potluck, bring your favorite food. No pressure, no stress. Let's just get together and play a couple of games and celebrate the new year." Now, to you, the patients, do not dare hide in your house. Do not dare assume that you're not worthy. Do not assume that they deserve better than you. Bullshit. You have an important role in your family. And I want you to stand up for yourself. I want you to remember that you're here for a reason. There's only one you. God has put you here for a reason. IC doesn't make you weaker, it makes you stronger. One of the blessings of IC and pelvic pain is you will never, ever walk away from somebody in pain. Never. Because you know what it's like to suffer. And that's why I cared for my parents. You're going to find when you get back into it that there are other people struggling. Like we've been having a lot of discussions about blood pressure recently, because that's something that I'm trying to get my blood pressure better, right? And it's better. I started amlodipine and I'm good. No side effects. Yes. Okay. So for those of you, again, for those patients, you got the holidays coming up. Listen, you're a beautiful person. You have an important role. Now listen, if you don't have family, look for the people who are going to be alone. Look for the people on your street. Look for your family. Look for your friends. Commit a random act of kindness. You know what? Make some chocolate chip cookies. Take them to your neighbors. Take them to the widow down the street. Take them to that friend who's going through a divorce. We got to, this is about kindness. This is about love. This is about caring. You deserve it. I deserve it. Let's spread it together. The holidays are always challenging. Sometimes you can't follow the family tradition. Grandma died. She's no longer making the lasagna. It's okay to have new family traditions. And so I want to challenge you to think about what is one thing you can do that would just give you great joy? Give you, not your family, you. What's one thing you can do that would lighten this load for you just a little bit? That would give you joy and comfort. You get to have something special happen for you too. So I hope this kind of makes sense. Ashley has low blood pressure. No, mine is high. Mine got very, very high caring for my parents out last year. I got to tell you, I was shocked. 150 over 100 was my steady blood pressure, probably for a couple of months. Now it's like 135 over 90, and we're just trying to get a little bit lower. Destiny said, I was suffering from chronic hepatitis B. I spent a lot on drugs. I never thought a day like this would come and I would be able to give up drugs. All right. Honey, Destiny, we don't use this website to promote people selling herbal medicine, honey. Okay, we don't do that here. So I'm going to hide your comment. All right. But if you've got IC and you're struggling with things, let me know. Ashley's blood pressure is 60 over 30. Girl, that is low. That is very low. Wow. Why do you think it's so low? My mother had very low blood pressure, but her blood pressure was in the, 95 over 65 range. Okay, now there's one other thing I want to talk about. So you got my little thing about the holidays and standing up for yourself. I want to talk to you very briefly about a patient that I've been working with for several weeks now. And this patient calls almost every day. And in the kind of broad presentation of IC, this patient has very mild symptoms. Bladder wall healthy. Pelvic floor very tight. Anxiety off the charts. One of the most anxious patients I've ever worked with. And it's a real, how do I want to say this? Sometimes when you're stuck in tremendous anxiety, you're spinning in a circle. Hey, have you tried this? No. Will you do this? No. It's like you're so consumed by the worry and the fear. God forbid you have to pee within an hour. It all cycles up. Oh my God, it's come back. I'm going to die. Oh my God. And we call that the runaway train. And one of the things I said to this patient is flares don't scare me anymore. They don't scare me at all. Number one, because I know that there are different types of flare. I know what triggers those flares, and I know that flares resolve. That if we take the time to learn about the types of flares, you can have a bladder wall flare versus a pelvic floor flare versus a stress flare versus a hormone flare, right? So we got at least 4 different types of flares. I learned early on that I flared the day that I ovulated. And because I was doing a voiding diary at over 3 months, it was the summer of 1993, I thought, oh yeah, look at that. Look at that. I always flared the day that I ovulated. Nothing to worry about. Like I knew to expect it. I knew it would go away. And I no longer let that anxiety control my life. Now, as I said to this patient, I was consumed the first year. You got to understand, my pain was really bad. And I'm pain-free now. Okay? I'm pain-free now. But that first year, I truly believed that I was dying of cancer. Even though they found nothing. And they said, you have chemocystitis and interstitial cystitis. And I went, I don't believe you. I'm dying. I have to be dying. This pain is so bad. I want you to open me up. I want exploratory surgery. Because for a year, that was what I was saying on the inside. I'm dying. I'm dying. I'm dying. My anxiety was really bad. And I finally got to the point, it's like, I'm sorry, I don't believe you. I believe that I'm dying of cancer. I believe that you've missed it. Open me up. And my OBGYN was like, really? And I went like, hell yeah, open me up. So in September 1993, I had a laparotomy. I was eager for it. I wanted it. I wanted to know what was causing all of this. And I woke up in the recovery room to his smiling face, Dr. Bennett, who said, Jill, we found nothing. It's IC. You're not dying. And I needed to hear that. Until I heard that, my anxiety was off of the charts. Of course, now I know that they can check for cancer with a simple urine test called a urine cytology test. You don't have to be opened up. So I relate to somebody who is very, very anxious because I was very, very anxious. And sometimes when I work with patients and I do my coaching for patients, the most important thing they need to hear from me is, I'm not worried for you. You're not peeing blood. There's no sign of any aggressive disease happening in your bladder. Your cystoscopy showed a normal bladder wall. Your pelvic floor muscles are rock hard tight. That is not a disease. You are not dying. That is an injury. Now we have to work on that. We got to work on those muscles. We got to get things calmed down. And it's been challenging. So this patient is a computer programmer, so I talk about it in the form of data. It's like, okay, when you write a computer program, you gather data and you look here, you go this direction, then you go this direction, then you go this direction based upon the data. So what is the data telling us about your case? Number one, you have a healthy bladder wall. But this patient simply does not believe that. And I said, okay, if you don't believe that, have a hydrodistension with cystoscopy and let them look. And then it was, yeah, but it'll hurt. Well, don't you want to know? Are you going to spend the next 5 years worrying unnecessarily that you've got a bladder disease? So this patient has had 2 cystoscopies, they were normal. I was like, okay, let's finally put an end to this. Have a next generation test. Let's see what's going on in your urinary biome and let them look at your bladder. I got no problem with that. It's data, it's facts. And at this point in time, you need data and facts to ease your anxiety. So if you're worried that you've got something mysterious going on, don't sit at home and worry about it. Ask the question, doctor, this doesn't make sense to me. You haven't looked in my bladder. Could you please look in my bladder and make sure there's nothing going on in there? That's a perfectly reasonable thing to do. The second barrier is, okay, now we know you have very tight muscles because you've been told you have very tight muscles. What are we doing about that? But Jill, I don't understand why I have bladder symptoms if it's my muscles. Because if your muscles are really, really tight, they're restricting blood supply to the bladder. You're in a state of ischemia. If your bladder is supposed to get 24 units of blood a day and it's only getting 10, are you going to have a healthy bladder? No. The bladder wall is going to be compromised. And I've said that multiple times over and over and over again. So what we've got to do now is we've got to get back into physical therapy and let's see if those muscles are responding. Because if those muscles are not responding, if those muscles are always locking back down into tension, as is the case for so many of us, myself included, we have to figure out why. Is it a bad hip? Is it a bad SI joint? Is it a bad knee? Is it a bad foot? And it's so interesting talking with patients because it's like finding a needle in a haystack. One of the questions that I always ask is, was there any trauma? Can you remember any accidents? No. And we'll have an hour-long discussion. No, nothing happened. And then, oh yeah, something really did happen. I had a bad motorcycle accident or something like that. And then last but not least, we have got to break the anxiety because it's the anxiety that is perpetuating all of this depression and more anxious thoughts and the panic attacks. Every time you have a negative thought, you give yourself a jolt of adrenaline. And the problem here is you're not just having one negative thought a day, you're having 100 negative thoughts a day. That's 100 jolts of adrenaline. Adrenaline is a chemical mediator of fight or flight. What does it do? It raises your heart rate, it raises your blood pressure, it tightens your muscles. And for that patient with anxiety disorder, we are essentially overdosing on adrenaline. There's so much adrenaline going through our body because of all these negative thoughts that it's just perpetuating everything. The muscles will always stay tight. There would be more, the more anxious you are, the more negative thoughts you have. You get stuck in this vicious loop of anxiety, tension, anxiety. Oh, I mean, it's just heartbreaking. As I've been there, I understand that completely. And so we also have to be really, really clear that anxiety is not your friend. Anxiety will intensify your pain. Anxiety will intensify your depression. Anxiety will keep you home when you want to go out and live your life. And so when we talk about, especially for those of us with widespread pain, mindfulness, that's the Bible of calming everything down to get you out of anxiety, to reduce your pain. That's why we do our deep breathing. This is not a mental illness. Nobody is saying this is mental illness. This is essentially a central nervous system injury or trauma. We know that 80% of patients who develop multiple pain, that it comes from an injury, often in childhood. And for the other 20%, it comes from abuse or bullying. And so again, with this patient, they were just consumed by the anxiety over and over and over again. And so I'm immediately thinking there's got to be a history of trauma there. Some when this patient was much younger, that we've got to try to understand, because sometimes it's past trauma that can drive anxiety, which then drives muscle tension and all that sort of stuff. So if you suck at anxiety management, as I did, if you're sick and tired of having panic attacks before getting in the car and going somewhere or going to the doctor's office, at some point in time, you have to cry uncle and say, you know what? I suck at anxiety management. I just suck. I need some skills. And that's what I did. I already had a master's degree in psychology, and I was a straight A student in psychology. I was very, very successful in what I did. And yet I still had panic attacks. And one day I was like, I'm done. I hate this. I hate living with anxiety to this degree. And I signed up for a class that absolutely changed my life. And I have not had a panic attack since I've taken that class. And I've only come close once. And that was at the dentist's office. I know what to do. I know that for me personally, one negative thought, that's okay. Two negative thoughts, I got to stop that sucker in its tracks. What I do is I visualize a stop sign, stop. I take a single deep breath in, out. And then I remind myself it's a thought. It has no power. That's just my brain guarding from past trauma, because I have a history of trauma. That's called trauma-informed care. Lisa says, I don't feel anxiety, but it must be there. Well, honey, you might be coping very well with this, and I applaud you for that. But for those moments when you find yourself dwelling on it and worried, it's like, and when you start saying no to everything, no, I don't want to go to Christmas. No, I don't want to go to Thanksgiving. No, I don't want to go to the doctor. No, I don't want to try that new treatment. No, no, no. That's a brain that is stuck in anxiety. That's a brain that is guarding you. It's trying to protect you. That's the fight or flight controlling your brain. And for some of us, I had fight or flight going back to 4th grade when I was first physically attacked by a kid who would later become a rapist and murderer. I was in fight or flight from 4th grade through high school. I was afraid to walk out of my house because I would be attacked. And I came from a very loving home. We just had a severely, severely mentally ill person in our neighborhood who terrorized it for years. and he became a murderer. None of us were surprised. So, and ironically, he was the son of very, very violent alcoholics. So he was a victim of trauma too. So, anyway, okay, well, listen, enough on that. Please don't live in anxiety. If you're struggling with anxiety, I've got a great video on the IC Network website that talks about the class that I took. It changed my life, and I no longer live in those negative thoughts like I used to. What's so interesting is that when you live in anxiety every day, you begin to doubt yourself, and then you begin to think you're damaged goods. And I was really shocked when I actually had an opportunity to listen to what I was saying to myself. It was shame, utter and total shame. And I'm not ashamed anymore. I now understand that I was a victim. Lisa said, not sure if this has ever been discussed, but has anyone gotten icy symptoms after a shingles vaccine? Um, you know, that has come up before, with some patients saying yes, some patients saying no. Vicky says, wow, thanks. I didn't know, and I felt that way a long time. Exactly, girl. I got your back. We are in this together. We are in this together. And our goal is to remind every one of us that we deserve to be here and we deserve to live with happiness. We do. So getting back to Lisa, it's not consistent. Every now and then somebody will say that they believe that their IC began after some type of vaccine, whether it be the COVID vaccine or the shingles vaccine. I will say that my brother, who is literally my twin, although he's 8 years older than me, we look alike. We have the exact same hair. He doesn't have a good skincare routine, so we don't look alike in that respect. He got the shingles vaccine, and 2 weeks later, he had shingles. And 5 years later, he's still on meds for it. And so I'm really personally tortured about having the shingles vaccine. My sister has had shingles. My brother has had shingles. I have not had shingles. But my brother and I are so incredibly alike. I'm struggling with that myself. I don't know how to answer that question. Listen, I believe in vaccines. Vaccines save millions and millions and millions of lives. The vaccines that we all had when we were much younger, for those of us who have the scar on our shoulder because we got the vaccine in school. I don't yet even remember what that was for. I have had the COVID vaccine. I have no hesitation about the COVID vaccine. I have every intention of wanting to protect my nervous system. But ultimately, in the end, this is about you reading about it and deciding what's right for your body. Renee says, oh, thank you, Vicky. It's a smallpox vaccine. Do I even have it? Is it on this arm? I remember us all lining up in a row at school. Is it there? That might be it. Or is it on this side? Well, it's there somewhere. Ultimately, vaccines are we each have to do our own research and decide what we want to do or not. I'm very invested in wanting to protect myself from long COVID and protect my brain and my nerves. And so I am doing that. I need to get a tetanus vaccine soon too. Oh, we were talking about this yesterday at the baby shower, and my nephew got 4 vaccines at the same time. He got COVID, RSV, the flu shot, and he got a new tetanus vaccine, and it knocked him on his tush. He was all cocky. Oh, I can handle it all. He was down for like 4 days. So I don't recommend doing lots of vaccines at the same time. Anyway, Renee, I, so I'm sorry. Renee says, can lysine supplements fight shingles? Absolutely, because lysine inhibits viral replication. So for anybody who's struggling with viral infection, especially herpes, canker sores, cold sores, they sell lysine chapstick that is very, very good. It cuts the infection time down by half in many cases. So for those patients who have Hunner's lesions, where we suspect, and especially if they have an active history of Epstein-Barr mononucleosis, that's something that I will often talk about and or suggest. Oh, girl, Lisa used to believe in vaccines. I was in the military and went down a gauntlet of shots, but after reading all those injuries, well, the military is a special situation too, because you're going to foreign lands where there's so many more diseases. And so anybody who's gone into the military knows you get a bunch of vaccines. And it's a roll of the dice kind of at this point in time. Please talk to your doctor and do your reading if you have any concerns about any of the vaccines you're taking. Renee says, I can't take any vaxes. You had a reaction from the flu vax, allergies to 5 antibiotics. I remember the school lineup. I did do okay with tetanus after a dog bite. Yeah, I've done well with flu shots, but I did have a reaction to one flu shot that landed me in the ER. And sometimes it's based upon how healthy you are when you have the vaccine. Peggy says, anxiety from having bladder pain for over 20 years. All right, so Kayleen, hold on. I got to get back to Kayleen here for a moment. Oh, and Carolyn says, hold on. Carolyn says, I've recently heard about a connection between COVID and bladder problems. So I've had a bladder flare starting 3 months after COVID. This flare is 8 months. Okay, so Carolyn, we've been doing actual research on this now for 3 years. We're the only IC group that has actually been studying the impact of what COVID does to a typical IC patient. And that study is still active in the IC Network Survey Center. So what our research showed is that 75% of IC patients who got active COVID experienced a flare. 25% noticed no change in their bladder symptoms, but 75% did. And 25% within that 75% reported a very severe bladder flare that lasted on average about 6 months. Now, about 2 to 3 months into the pandemic, COVID researchers in Germany published their first bladder paper where they noticed that patients who developed COVID, some patients who developed COVID also developed very severe, what we call de novo urinary symptoms. What that means is they had no previous history of bladder issues until they got COVID. And we call this now COVID cystitis. And it's now years later, we have many studies that support this finding that COVID can affect the bladder. We know COVID can affect the bladder in 2 ways. Number one, that cytokine storm that happens with a COVID infection, especially early, that first year of the COVID infection, it was a cytokine storm that was causing all this damage to the lungs and everything. Markers for that cytokine storm were found in urine. So we knew that cytokine storm reached the urinary tract and the bladder. So we knew that. Then they started finding in patients who had very, very severe COVID, who were in the hospital for long periods of time, they actually found living COVID virus in the bladder wall. But that was only found in patients with very, very severe COVID, where you've got a body under tremendous distress, unable to defend itself against a virus, where you've got a viral infection running rampant throughout the body. And it makes sense that it would reach the bladder too. Now, so I have a website on that, covidcystitis.org. covidcystitis.org. So you can go read about the research there too. Now, Serteria says, hi, can I still call you about the hyperemia in my bladder? No doctor can tell me what it is. Absolutely, honey. Absolutely. Weren't you going to call me last week and you didn't? You can call anytime. It's okay. Just know that Mondays are my day off. And so even though I start answering the phone at noon on Mondays, I try not to do a lot of coaching because I have to rest my voice. Because my voice and my TMJ take a big beating when I do these meetings, especially the long meeting. Lisa said, can you get IC symptoms for an injury 20 years ago? Hell yeah, absolutely, Lisa. If that injury was an injury to your pelvic floor and to your pelvis, there is always a legacy to an injury, and the legacy can be kind of threefold. Number one, muscles that are injured become tight. And while you might not feel that they're tight, the legacy of any time you fall, you suffer a compression injury, which basically can cause what we call a latent trigger point right in the muscle in your pelvis. And while you might not feel it, it's there. And the typical predictable track that we see are patients who suffer small injuries over time. So, God, I was working with somebody. Oh, what were they? Oh, skateboarding. Huge risk of tight pelvic floor muscles. And I was working with one of the, this was a couple years ago before COVID, one of the skateboarders who was competing in the X Games and ended up developing really severe urinary symptoms that were absolutely traced to his pelvic floor. I think about all those falls on skateboards and all those. I even fell off a skateboard fairly badly. Yeah, I remember that in my driveway. Never got on another one after that. So we look for that history of repetitive traumas or falls. Sudaria said, and yes, I was supposed to, but I got a really bad flare. But that's when you can call me. It's when you have a really bad flare. Listen, guys, if there's anybody you can cry to, it's me. Number one, if you're crying, you get my first priority. Everything else stops. And even if I have an appointment scheduled with another patient, I've told everybody ahead of time, listen, you got to be patient, because if I'm working with somebody who's crying and very, very distressed, they're always going to take priority. So if you're struggling with pain and you just want somebody to talk to, or you want that little bit of support, it's okay. You can call. No, it's first come, first serve. And the challenge sometimes is I'm already working with somebody and you might get my voicemail. Leave a message. I will call you back. And just know that I haven't called late. Suria says, can I call you today or no? So it depends on how long the meeting goes. If the meeting ends early, yeah, you can call me today. If we go a little bit long, once it hits 4:00, I have another thing that I usually start doing at 4:00. So let's just see how it goes. Otherwise, you can call tomorrow. Okay? All right, Kayleen girl. Kayleen, thank you for your patience. You're a sweetie pie. Let's go back to Kayleen. Now, Kayleen has been struggling with very, very complex pelvic pain. She's a regular visitor to our meetings. So most of you who are watching this have know about her story. She says she's doing good, except she has a bladder installation tomorrow. The food excluding has happened to me more times than I can count, even when they know me like the back of my hand. I'm with you. We're talking about food during family meals. That's kind of, passive aggressive. And we have a situation in our family right now where we've got one person who really has to be very careful with what they eat, and another person is cooking, and it's like they almost deliberately make food that they know this person can't eat, and it breaks my heart. Very passive aggressive. So again, we can bring our own food. We have hands, so we can make our own food. I've been making a lot of gosh, you know what I made last week is I baked an acorn squash and just cut it in half, and I had one half one night, the other half the other. Made myself a grilled cheese sandwich and some squash, and it was fine. All right, let's get back to your other message, Kayleen. Sorry, popping on from other Facebook. It's okay. I have a clitoral adhesion that is getting worse little by little. I got sick with a gastritis flare on top of a sinus infection. Probably the antibiotics or the sinus infection messed up your stomach. I got pretty dehydrated from vomiting and low appetite. My urine got concentrated, and I noticed that when my clitoris started to hurt from wiping, urologist said he won't work on it. I called Chicago to inform my OBGYN and urogynecologist. The OBGYN called me right away, said he won't do it. I'm hoping and praying the urogynecologist will do it. I know if I do it, if I do it, I will pass out. I wouldn't want to explain that to the EMTs. Oh, Kayleen, I got to tell you, why are some of the handsomest guys in the world the guys we've got to talk to about some of this stuff? I don't know what it is about firefighters, but they're adorable. They're young and hunky and handsome. I've had many of them in my home in the last couple of years with my parents, and they're just absolute sweetie pies. And they've seen it all. Yeah. Yeah. And many times they looked at me urgently and said, "Can you do something?" It's like, yes, I will take care of the fact that my mother has had an accident, but you still have to take her to the hospital. I wonder if just a simple a wash bottle. Just spraying yourself off with water several times a day very gently might help dissolve and or loosen some of that, maybe? Um, okay, hold on a sec. Uh, Carolyn said her COVID is bad. You had a cytokine storm, swelling and hives. Yes. I read using antihistamines. Certainly an option. Sure, it's certainly an option. Going to help you sleep at a minimum and just calming some of that kind of inflammation and irritation throughout your body. Doing something like hydroxyzine makes total sense. That's a normal therapy given for IC anyway, especially for patients with a history of allergies. That's when it's the most successful. Marlia says, and you guys just know I'm streaming. I'm streaming on two platforms. So when I look over here, I'm looking at YouTube. When I'm looking here, I'm looking at Facebook. So please be patient with me as I look through both. So Surgery said, I read up that Hunner's lesions are a characteristic of Hunner's. Huh? Hunner's lesions are basically open wounds in the bladder, and I have some pictures I can show you. Hold on. So this is a distinct subtype for IC. 5 to 10% of IC patients. Remember, the IC patient population is a very diverse patient population. We're not all the same. IC is essentially a grab bag diagnosis. A doctor will just say, hey, you got frequency urgency. I don't know why. Obviously, you have interstitial cystitis, but a diagnosis of interstitial cystitis is fairly meaningless. It's fairly meaningless. That's why we do something called phenotyping now, because we need to get beneath that diagnosis of interstitial cystitis and start exploring potential causes. That's why at your first appointment, they're supposed to do a pelvic floor assessment. Are those muscles tight? That's a distinct group. They're supposed to look at your urine. Is there any funky things going on with respect to infection? They're supposed to look at your skin. Let's make sure we're not dealing with an estrogen atrophy issue for those women whose symptoms develop after having a hysterectomy, going on birth control, or just getting older. I was working with a patient who had a prolapse, very interesting patient with a prolapse. It was a cystocele, and what was interesting is that um, she had never worked with a physical therapist. And it's like, "Do you understand what a prolapse is?" "Yeah, things are falling out." "Okay, do you know why?" "No." "Usually it means your muscles are very weak and not holding things into place." "Oh, I didn't know that." Okay. And so having an opportunity to have a pelvic floor assessment from a properly trained physical therapist to try to understand what's going on with your muscles is very, very important. So, anyway, getting back to Hunner's lesions, I can show you pictures. So, this right here, that's a really good picture of a lesion. They're basically big wounds. These pictures down here are lesions that have healed and or scar tissue after treatment because they've been lasered. Let's see. Lesions are characterized by they often have a red center. You see this right here. See that picture right there? That is what we call a coagulum. And then the redness often spreads in a stellate, looks like a star. It spreads outwards from this center. So those are examples of some lesions. It's a stellate appearance with neovascularity with central coagulum. But some Hunner's lesions do not have that center. So the question then is, what the hell is a lesion? Why do these lesions occur? Because for many, many years, we thought that was a disease, a weird, funky disease. But now we know that there are two very, very logical causes for lesions. Number one, a viral infection. And that research is solid. It started about 6 years ago with researchers in Europe who kept finding the polyoma virus, which is a virus we all have that gets turned on in patients who are immune compromised. And the polyoma virus is associated with hemorrhagic cystitis, bleeding wounds in the bladder. And we've also found the Epstein-Barr virus from mononucleosis in the bladder. And to a lesser extent, there's always a chance that there could be HSV or herpes. But viral infections are possible. And then the other possibility for causing a lesion itself is a nerve that's become very, very inflamed. Here, let me get a drink. Once I get the needle sensation in my left tonsil, that's always a sign that there's going to be coughing happening, and that just happened. But hopefully we've nipped that in the bud. I love show and tell, so let me show you a couple of other pictures. You want to know what glomurulations are? Little red spots on the bladder. Now, for many years, we thought this was IC, but this is now thrown out. Petechial hemorrhaging or glomurulations are thrown out. Now, this is basically what happens when you stretch the bladder, and it's found in other conditions too when you stretch the bladder. So these petechial hemorrhages and glomurulations, for those of you who were diagnosed 10, 15, 20 years ago, pointless. We don't care about those anymore. That just means you had your bladder stretched, most likely. You want to see a bladder stone? Check that out. How do you like that? How do you like these apples? You see the rough edges of this bladder stone? So this was a picture from a friend of mine who actually we're friends now. Reached out to the IC network about 4 or 5 years ago with very, very severe urinary symptoms, but he was not an IC patient. He was an injury patient. He'd had botched surgery on his prostate, and he's since had about 12 surgeries to repair the damage done by this ridiculous doctor who did surgery when he should have never had surgery. And so again, not an IC patient. You don't have to worry about what happened with him. That's not going to happen with you. So what was interesting, the final surgery that he had, they left a bleeder in, and his bladder filled up with blood clot. They sent him home, and he couldn't pee, and his bladder filled up with blood clots. Emergency, back to the doctor, back to the ER, into the operating room, where literally his bladder just broke in two pieces. It was so full of blood. And when they surgically repaired it, these stones grew out of that giant wound. It's not happening now. That major injury to the bladder disrupts a calcium metabolism pathway, and the calcium gets up coming right out of the skin. And so this is a bladder stone. It doesn't happen in IC. It happens after major bladder wall injury, but I thought you'd find that cool. And if you want to see what bladder cancer looks like, here's a good picture of a bladder tumor. And it's like soft jelly, clear soft jelly, because remember, cancer is basically cells that are just growing too fast. That's essentially the cancer process. And so this is basically a bladder tumor. And this was not in an IC patient. You don't need to worry about it. That's just show and tell, because I like show and tell. All right, we're done with that. So let me go back here. So Marlia says, I saw something on an IC support group that they took something called, not sure how to spell it, Piedra Chunga. I have no idea what that is. Ashwagandha. I bet that's what it is. Ashwagandha. We sell that in the IC Network store. And that's pretty good for reducing, what is this mechanism of action? I don't remember off the top of my head. I think it has an anti-inflammatory effect. So ashwagandha. So we had some in the IC Network store, but they timed out. They expired. So we're probably not going to carry that again. Larissa says, oh crap, Jill, I had COVID-19, pneumonia, RSV, and was in the hospital for 28 days, almost died, on a ventilator for 15 days. Woman, I'm so glad you're here, but you're now a long COVID patient. My lungs are tainted and I just finished respiratory rehab. I will speak with the doc tomorrow about the COVID cystitis. Yeah. The COVID cystitis does not appear to be long-term. 6 months, a year, but usually things calm down. Anne says, what is neurogenic bladder? Neurogenic bladder means that the nerves in the bladder are just not functioning correctly. So for patients who have MS, patients who are in a wheelchair, have suffered a spinal cord injury, something like that, that can all lead to something called neurogenic bladder, where the bladder just can't function. It's not functioning anymore. Kay Kawai says, I was diagnosed and had 300 lesions, recently had a fulguration. I think my IC and lesions are linked to my lupus. Have you heard of that being a cause? Well, so yes and no. Lupus itself does not cause direct bladder wall issues that I'm aware of. Now, granted, I haven't read about it in a while. I did study it several years ago. But when you have lupus, that means that your immune system is compromised, and that opens the door for viral infection. And that's what our research is showing. The research that started in Europe, and then our own National Institutes of Health here in the United States did their own viral study, and they too found an opportunistic viral infection called polyoma. Polyoma BK is one type, and polyoma JC. And so my guess would be that you could potentially have a viral infection in your bladder. We have all of that research over on the IC Network website. And if you want to reach out to me personally, I would be happy to send you a link so that you can read that. This is not a crazy woman talking about this on the internet. This is validated research from Europe and now the MAPR Research Network in the United States. See, the Europeans were the first to find it. And mysteriously, the IC research community in the United States was very quiet. And we're like going, guys, what do you think about the viral infection thing? And nobody would say anything. Well, what we didn't know is that they were doing their own viral study because the MAP Research Network, which is our premier IC research network here in the US, had urine samples from hundreds of patients over time. So they could follow the urine of patients over several years. So they went back and they tested those urine samples and they found polyoma infection in about 5% of those samples. And now we have newer research with Epstein-Barr also. So yeah, my email is icnetwork@mac.com. Cytsuria is hyperemia, a characteristic of a Hunner's lesion. I can't say that I've read a paper that has specifically said that. I'm just seeing, I just want to see if there's any papers. Yes, 2013. The cystoscopy characteristics of the bladder ulcers were central hyperemic patches with peripheral scarring and increased vascularity. So that is a hard yes, my friend. A hard yes. Alrighty. Hold on a sec. Kayleen said the Perry bottle is too weak and it blows a lot of air. Really? I mean, you can fill it up to the top, squeeze pointing away from you, and then you've got good water flow for a couple of seconds. Girl, listen, you're the master of your body. You know what feels good and what doesn't feel good. You got to do what feels good. And if a Perry bottle doesn't feel good for you, Kayleen, then don't use it. Gina said, can you tell us more about inflamed nerves inside the bladder that you mentioned when you were discussing Hunner's lesions? Okay, so the bladder wall only has two distinct nerve groups. It has the alpha afferent nerves, and the alpha afferent nerves are the nerves that tell you when you need to pee. So the symptom of frequency urgency is driven by the alpha afferent nerves. Now, this nerve is meant to be easy to turn on because it's the nerve that tells you when to pee. So it's generally the first symptom you're going to experience anytime you've had a bladder wall issue. The second nerve group is the C fiber, and the C fiber is the pain nerve. And the pain nerve is actually quite hard to turn on. And generally, the pain nerve only turns on after a distinct trauma. Let me get another drink. That tonsil is talking to me. So, an example of something that would turn the pain nerve on would be riding in car for a very long period of time and not being able to use the restroom, somebody not pulling over and letting you use the restroom. So your bladder gets stretched badly. That's an example of a trauma that would turn on that pain nerve. So, the other thing we have to remember about nerves is that viruses live on nerves. That's where viruses go to stay. Once you have a viral infection, that viral infection it might not be symptomatic, but it's still in your body and it's living somewhere. And generally, it's living on those nerves. So, if the alpha afferent nerve is injured, that patient is going to have a lot of frequency urgency, um, as well as pain. And so our job is to recognize the physicality going on. Your job is to create an environment that will allow your bladder to calm down and heal. And so I was working with a patient, a man, a couple of days ago, who had he had bladder cancer, and they overdosed him on a bladder chemotherapy, and he ended up with the equivalent of very, very, very severe bladder damage. His bladder looked like ketchup, bright red, because the nurse accidentally doubled the dose of the chemotherapy he was receiving. And so, obviously, really terrible symptoms. Getting up 10 times a night, peeing all day, all night, really changed him in for the worse in many, many ways. And yet, um, he was drinking coffee every day. And he did not understand that pouring coffee on the wound every day was just going to perpetuate the wound and make it worse. And so the trauma happened a year ago, and he'd been drinking coffee every day since the trauma happened, and his symptoms were getting worse and worse and worse. And so he's now off of the coffee, and thankfully he loves the herbal coffee that we love called Dandy Blend. And slowly things are starting to turn around. The bladder is starting to heal. The nerves are starting to calm down. You can't pour acid on the wound every day and expect it to get better. It's just not going to get better. The bladder is the slowest healing organ in the body. It takes 2 weeks for one cell to be replaced. And the problem is that stem cell that's trying to grow and change and adapt and fill in where the injury was. It takes 2 weeks for that stem cell to actually do that job. And while that tissue is growing, that stem cell is growing, it is exquisitely vulnerable to acid. And so every time you drink a cup of coffee, when you have a bladder injury, you destroy the entire next generation of cells trying to heal your bladder. And that's just not good. We have got to protect the bladder. We've got to protect those wounds and give the bladder as minimal trauma as we can to try to give it enough time to heal. And that's why diet is important. You got to be on the diet, maybe 6 months. Really give these tissues an opportunity to calm down. And then once we've got better healing happening, you can start again. But drinking coffee, at that point in time, your bladder has shown you it can be hurt. And maybe that coffee habit is not healthy in the long run. Maybe it's just too damaging, especially as you get older. Kawhi said, is there a treatment for Hunner's lesions if caused by virus aside from? Yes, actually, we had our first study from Europe. I just talked about it in our spring magazine in the IC Optimist. So we had our first presentation of antiviral therapy to be used with patients who were positive for virus in their lesions, and it was very successful. Our challenge here is that local doctors just don't have this information. So if you reach out to me, I can email you a copy of the magazine that has that research study in it that you can share. There's just no doubt now that viruses are playing a role in some patients with Hunner's lesions. There's just no doubt. So doing that lysine every day, which might lysine is a simple amino acid that interferes with viral replication. That would be something that if it were me, I would be using, because I use lysine whenever I get canker sores or cold sores. Aaron says, thank you for all you do. Could you go over briefly what the supplement PEA is for? I missed the explanation last week. Yeah. Let me get it. Oh, wait. It's right here. Okay. So PEA, palmitoyl ethanolamide. So palmitoyl ethanolamide is a simple fatty acid that the body produces. It's derived from eggs also, and has been used and studied in Europe extensively for the last 20 years. So I first learned about PEA back, gosh, it's a San Diego AUA conference, 18 years ago, somewhere in there. And we had a doctor down in San Diego who was working with a pharmacy to import it for his IC patients who had pain. But it was very, very expensive back then. And so it really fell off on my radar. But it turned out that PEA is a hot topic over in Europe. There are dozens of research studies with PEA and all sorts of different types of pain, from acute pain, chronic pain, surgical pain, fibromyalgia, burning mouth syndrome, migraines, etc. And PEA, the simple over-the-counter supplement, has been remarkably safe and effective in the great majority of these studies. So in 2019, the Italian researchers with PEA presented the results of an IC study at the AUA conference, the American Urology Association conference in Chicago. Every year it goes to a different town. And the data was just absolutely mind-blowing. The 87, I think 0.5% of IC patients using PEA by month 3 had a significant reduction in their pain and symptoms. And by month 6, many patients were completely pain-free. So PEA acts as an endocannabinoid. And the general consensus among the researchers is it's effective because it calms nerves down. So the urologists that were attended that event I wasn't there. I was told that they became very, very excited that they could now recommend something that was not an opiate, that was not associated with addiction, that was not associated with any side effects. There were no side effects in the IC study for their patients who struggle with pain. Now, of course, I saw this study and I went, oh, I need to read a little bit more about this now. This is very, very exciting. So I went over to the National Library of Medicine and went through about 30 studies. All this research that had been done in the intervening years, I was completely unaware of. And I was absolutely shocked at how effective it was and how well tolerated it was. And so I'm like, okay, there's nothing else that's ever been studied for IC that has been that effective other than pelvic floor physical therapy. But now that we're phenotyping and we understand that there are patients in the widespread pain group who very clearly have a very sensitive central nervous system, the role of PEA absolutely makes a lot more sense. So I took the study to the company called Natural Approach Nutrition and said, okay, can you make us something like this for here in the United States? And they did. It's called Peora PEA 500. And we've had this now for about 3 years, maybe 4 years? No, 3 years. Okay, so I can spell it out for you. I can write the name. You can do your own Google search, just like I did. I want you to be I want you to do your own reading. I want you to become informed. You shouldn't just believe anybody on the internet who says something's good. You got to do the reading. And I can back this up with a lot of research. So here's the thing. You know, I don't like taking stuff because I'm the queen of side effects, right? I really don't like taking things. Even when our low acid vitamin came out, I waited about 4 months and I let other patients try it first because I've been in the emergency room too often with reactions to medication. Um, but I was struggling with very, very, very sensitive skin. I have small fiber polyneuropathy, which is common in about 30% of the IC patient population, probably the widespread pain patients like me. And going to sleep became very, very difficult for me because I kept feeling like I was being poked by pins and needles. I'd have a big tub of therapy in bed with me, and it was like I was chasing very tender, dry skin. And really, after menopause, it just got exponentially worse. And I had some nights where I couldn't go to sleep. I couldn't go to sleep. And I might have to use a little bit of Vicodin to try to go to sleep to calm it down. And it was really affecting me. And so then this came out, and the researcher said calms nerves down. And I'm like, what the hell? I'm going to give it a shot. I'm so glad I tried it because all my nerves are calm now. My skin is fine. My skin is fine. I don't have instead of dealing with hundreds of pins and needles trying to go to sleep, I might have one little zap once a week. This has been stunningly effective for me personally. And understand too that I'm not for sale. I've had a lot of companies say, "Hey, try our product. We'd like you to be the spokesperson. We'll pay you to do it." I've refused all of those offers. I am not for sale. My opinion is not for sale. And I tried it because I was struggling. And I am telling you truthfully, for me, that PEA has been stunningly successful in calming my nerves down. And so I have no skin sensitivity anymore. And I think that it's worked very systemically for me as well. And the thing that's even more important is just what we call durable. Because I don't take it all the time. I might take a bottle or two, one bottle a month. And it's also literally one of the cheapest supplements we have. It's under $30. And then I don't take it for 2 months, and it persists. And again, when you look at the research, virtually, I think I only found one study that reported minor side effects. The vast majority of studies out there showed extremely well tolerated. And so, of all the supplements that we have, I think that PEA is the future. And this is why you now find this is just PEA by itself, but Bladder Builder combines chondroitin for the bladder wall, quercetin for the bladder wall, with PEA to calm the nerves down, which is why I think Bladder Builder is the best supplement on the market because it has the most methods of action and ways of helping. And of course, we have Allopath. Aloe can be very soothing to the bladder, like it would be soothing to a sunburn. But you combine aloe with the nerve calming effect of PEA, and now we've got something that many patients are reporting very helpful for bladder wall flares. So the blessing here is unlike 20 years ago, we have a lot of options that you can try that are available. And these are not fly-by-night companies trying to make a quick buck. Believe me, those are out there too. I work with the companies that I work with. We have a lot of conversations about stuff. So I can't tell you anything's going to work for you. All I can say is that these are options that you might want to try. But do your due diligence, read about it, and talk to other patients and see what they're doing, and read the research. And we all have different sensitivities. Some people can't tolerate aloe well. Some people don't tolerate quercetin well. Some people might not tolerate, A, B, or C. So it's really about trial and error to see if it would be helpful. Okay. So I hope that that makes sense. I hope that that makes a little bit more sense. Erin says she has burning mouth syndrome too. Burning mouth syndrome is common as you get older. I think that that's just an irritation of the nerves in the mouth because of dryness in the mouth, that just kind of like we see an irritation of the nerves in the bladder. That would be my best guess on burning mouth syndrome. I have occasionally had um, an irritated mouth and an irritated tongue. It does make sense, right? So you can go on over to the IC Network website and find it there. It's better if you buy it in our actual shop than going on Amazon, because even though we sell it on Amazon, um, it's going to be cheaper on the IC Network shop when we have volume discounts and stuff like that. I'm going to really try to find things that are affordable. I had, for example, a company that wanted me. I have show and tell. Hold on a sec. So one company wanted me to sell a vaginal dilator, and the retail price was well over $300, like $380, and I'm like, no, that's that's ridiculous. Can you afford that? Of course not. So I have a new pelvic wand. Now, can I just hold on? You know what? Let's just do a price check. Hold on. Okay, hold on. I'm falling apart here. All right, give me a moment here. Let me just do a quick price check on this one, because I, for one, am not going to pay $300 for a pelvic wand. Um, okay, excellent. This is under 50 bucks. Okay. So the new Flora pelvic wand. So they sent this to me. Well, actually, I bought it. I think I bought it. And I love the box. It says, "Hi, you've got this." And here is the wand. You can use either end as you're doing your internal pelvic floor work. It's made of silicone, BPA, paraben free, medical silicone, body safe. I think it comes in two different sizes. So I think we're going to try to have these in the IC Network shop. Great Christmas gift. Can you imagine? You can imagine telling your mom or your grandma or your, hey, honey, what would you like for Christmas? I would really love a pelvic wand. What? No, really. It's for physical therapy. Are you sure? That's not one of those vibrators, is it? I could totally see my grandmother freaking out. I can totally see her going, no. Anyway, so this is this wand. This is cool. But here's what I really like about it is it comes with a wonderful book, a booklet that talks about how to use it, how to clean it, choose an end. Either end can be used depending upon what feels most comfortable to use. The wider and pointed end provides greater surface area to help relieve deeper muscles, while the thinner, rounder end allows for easier insertion and can address more focused areas of tension. They want you to use a lubricant. They talk about, how to set yourself up. And they talk about how to use it. When speaking of points to apply pressure, we refer to numbers on a clock, with number 9 being on the left side. of the vagina, and 3 being on the right. So gently sweep upwards from 5 o'clock to 1 o'clock and 7 o'clock to 11 o'clock. That makes sense. That makes total sense. Um, and let's indicate instructed by your healthcare provider. It's best to avoid 12 o'clock. So when I do my pelvic floor work, Kayleen said, I've been tempted to ask, it's a gift. Okay, so when I do my internal pelvic work, and so guys, listen, if you struggle with tight pelvic floor muscles, you want to be independent. You don't want to be dependent on your physical therapist when you go into a flare. There's nothing worse than it being in the middle of your Christmas holiday or you're traveling somewhere and all of a sudden your pelvic floor muscles get tight and they hurt, and now you're not peeing correctly. Well, you're going to have a miserable time. But if you know how to do your internal massage yourself, you can nip that sucker out in 5 minutes. And so learning the skill of doing internal pelvic floor work is really, really important. And you can tell the health of your pelvic floor by how you urinate. If you peeing like a horse, your pelvic floor is good. If you cannot start your urine stream right away, or you're hesitating, stop and starting, or your urine's kind of going to the left or going to the right, kind of spraying in unusual ways, well, that tells us something's going on with your muscles. So for me, I lay on my bed and put my feet up on the wall and do some deep breathing, and then I use my wand and I look for areas that are tight and painful. And so, okay, so let's look at this clock model here for a moment. So you're laying on your back. So structurally, and this is your vagina for women, in front of your vagina up here is your bladder and your urethra. And below your vagina is your rectum and your tailbone. So this is a clock with 12 o'clock at the top, 6 o'clock at the bottom. So 12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. And so generally, you're going to work from 7 to 11 and 5 to 1. Also, as you're laying on your back, I want you to visualize your tailbone. So here's your vagina. Here's your rectum underneath your vagina. And there's your tailbone. And your tailbone's really the center of the musculature, because the muscles on your left side and your right side attach to your tailbone. So let me get my model here for a moment. Hold on. Okay. I can take out the bits. So let us ponder for a moment the pelvis. It's a small confined area with a lot of stuff going on. In this small confined area, we have the biggest bones in the human body, the hip bones. The bigger the bone, the more weight it's meant to carry. So your pelvis is the center. It carries the weight of your torso, but it also deflects all the stresses from your feet when you walk. Okay, everything is centered in the pelvis. And generally, when you're in fight or flight, some of the first muscles that get tightened is your pelvic floor, which is very interesting. So when we look at it from the front, hello, a pubic bone. Here's your bladder. Here, let's see if I can. So your bladder is basically, oh, it's hard for me to do this, right here. So your bladder is just slightly above your pubic bone. Okay? So when you push in right above your pubic bone and it's tender, that tells us that your bladder is probably a little tender right at this moment for one reason or another. So now let's consider the back. So here's the back of the pelvis. And so we see vertebrae from your spine. We see your sacrum. These are vestigial vertebrae that are all connected now. And you've got 4 holes on each side. That's where nerves from the spinal cord come down and go through these holes into your pelvis, into the center of your pelvis. These are the nerves that go down your legs and stuff, right? Okay. Now let us look at the tailbone. Okay, so the tailbone is really the center of it all. And you've got muscles that go and muscles that mirror each other. You got muscles that go this direction and muscles that go this direction. So roll with me for a moment here. So we're talking about the pelvic floor and we're talking about the um the hours on a clock. So now we're looking at the pelvis from the bottom. And as you and you guys, there's another layer of muscles that I can't use. So these are your levator ani muscles. And it's your levator ani muscles that wrap around the urethra and the vagina and the rectum. Okay. So when you're using a wand and you're laying on your back, okay, so you're laying on your back and you're putting your wand in, right? 12 o'clock, 6 o'clock, 3 o'clock, 9 o'clock. You're basically going on the left side and you're going on the right side. If I do it this way, you don't see a lot this way, but let's look at it from the top. Let's look at what you're actually doing because your pelvic floor muscles are actually big muscles. These are muscles that help you open and close your legs. And so when you're using a wand, you can see you're actually, see that? Look at the tailbone. You see the tailbone right there? There's your tailbone. So that's 6 o'clock. So you're generally going to be doing this on this side and this on this side. But you usually don't push right on the tailbone, just like you don't push up on the urethra. You're usually going to the sides because your muscles are on the sides. So that's the way a pelvic wand works. Healthy muscle feels like a raw chicken breast. It's soft, but it's got substance. A tight, painful muscle feels like beef jerky. And so when I feel like I'm not urinating right, my muscles are very tight, and I put this in, I'm gonna go first on the left side, and I'm gonna go on the right side. And I'm just looking for the tender, I'm looking for the tender muscle. And when I find the tender muscle, I'm gonna massage it. I'm definitely gonna massage it. And it will relax within a minute or two. It's remarkably easy to do. You just got to get used to it. And the other thing too is you'll be flailing for a couple of months. I mean, that's why learning about the pelvis and learning about the muscles and reading books are so important so that you understand what you're manipulating. You just can't stick it in there and poke around. It's not going to help. You have to understand what you're trying to accomplish here. And we're going to do just a gentle left side, right side, left side, right side. Shallow, deeper, but it's always left side or right side. Lisa says, I fractured my sacrum years ago. So Lisa, listen, hon, then you are absolutely going to have some muscle complications from that, most likely. Are your muscles tight? Christina says, wow, Peggy, I was doing pelvic floor therapy and I started popping in the pubic area. I told my therapist, but she did not seem interested. So I stopped going. Didn't always hurt, but I was really worried. I've been going to a chiropractor. So think that helped. You might want to check that out. They do x-rays. Hold on. What did I miss here? Peggy said, 8 weeks of pelvic floor physical therapy. I was working on it at home and I felt something pop in my right butt area. That night, I woke up with terrible sciatic pain. That was 3 weeks ago. Waiting to have an MRI to make sure I didn't injure one of my vertebrae. I can't sit. I make myself walk every day, only comfortable in bed. My anxiety and depression is getting up best of me, not giving up. I see a new urologist next week. She's female. Their patients love her. I want to get a cystoscopy done. I've not done one in 20 years. Anxious to see what she finds. The only physical therapy that helped me was that it made my stream better and getting up less late at night. But honey, that's substantial. Has not helped with the bladder pressure pain. I tried doing stretches on and off, but it automatically upsets the sciatica. So, Peggy, if I were to bet, I bet that you popped your SI joint, your sacroiliac joint. Um, so this is your sacrum. These are your hip bones. I mean, and they attach. And they attach in a longish joint right here and right here. Um, this and you might be able to see it easier here. See this joint right there? That's the SI joint on that side, and here's the SI joint on this side. It's a long joint that normally does not move. It's supposed to be very, very stable. When it start and one of the ways that it's meant to be made to be stable is through kind of some deeper musculature, potentially. But once that SI joint pops out of place, it hurts like hell. And I know that because it's happened to me. And the way I popped mine out of place was with a long pillow. You know how sometimes you can get these long pillows that you can hug? So somebody gave me a long pillow and oh my God, I loved that long pillow. I would be sleeping in bed and I would be holding it here and then it would be down the front of my body and then it would be between my legs and it was just cradling my whole body. But I would roll and I actually dislocated my SI joint with that damn pillow. So maybe what happened is as you were doing your pelvic floor work, you moved your knee outward in a funky way. You moved something in a funky way that popped the joint. That's separate and distinct from your bladder, hun. Remember, multiple things can be going on. So the fact that you can't, sciatica means you have muscles so tight they're squeezing the sciatic nerve. The therapy for that is, in fact, pelvic floor physical therapy because we've got to relax those muscles. But we also have to ask, why is the muscle tight? Is the muscle tight because you have a bony structure abnormality like I do, which means, in fact, look at that. I'm having sympathetic SI pain. I'm getting a little shooting pain right now, right down my left butt cheek, which I know is pain from my SI joint and from my pelvic floor on that side, my piriformis muscle. So don't let the pain distract you. Sciatica is from tight muscles, so we know we have to work on the muscles. And maybe what they might do is put you on a muscle relaxant for a while, but eventually you're going to want to be back in physical therapy, much gentler physical therapy to try to figure out why your pelvic floor is so tight. And the question you end up asking the physical therapist is, are my muscles always locking back down into tension, or are they slowly but steadily improving? If they're improving over time, fantastic. That's exactly what we want. But if your muscles are always locking back down into tension, as mine do on my left side, We have to ask why. And that's when we look at joints and that's when we look at bones. Um, and so for example, let me get it for you. Hold on. Let me get you something. It would be an interesting experiment. Hold on. Okay. So once they diagnosed me with an SI issue, my doctor said, "Hey, do you know what an SI belt is?" And I went, "No." That's a belt you can wear that will basically hold the joint together. So this is the big SI belt. I have a big one and I have a small one. My dad actually used this one. And so basically what you do is you wrap it around your hips like this, right? It's ugly, but who the hell cares? If it hurts and makes the pain go away, there you go. So an SI belt will kind of go right here, right along where that joint is. So, so my doctor said, "Go get an SI belt, see what happens." And I got this one at a local medical supply store, and I put it on, and my pain went away completely. I was shocked. I was absolutely shocked. But this is too big for me personally. You wear it under your clothes. Nobody can ever see it. I will only wear this if my joint gets funky, maybe a couple of times a year for a day. But I have a much thinner one now that's dark blue that nobody can see. So Peggy, don't assume that bladder treatments are going to make this go away. Bladder treatments are not going to make this go away. You still have to get to the root cause of why are your muscles tight. So you need to work with your doctor and work with your physical therapist to try to understand your anatomy a little bit more. I hope that makes sense, hon. Does that make sense? Kind of, sort of. Carolyn, yeah, body pillow, yeah. I love the body pillow, but boy, did my SI joint does not like a body pillow. No way, no how. Um, Hold on a sec. Lee says, "Hi, Lee. Nice to meet you. I'm one of the widespread pain patients. Me too. And I've tried everything. I'd love to try the PEA, but I'm not able to swallow pills. I contacted Nan to ask if they can be opened into water or food, and they said no." You know what I found on Amazon though is a powdered PEA. That you Now PEA does not dissolve in water, and that's the only complaint against it. But go on to Amazon and look for powdered PEA because I think you could put that into food. Um, uh, Hold on a sec. Let me just go to it real quick. So Amazon.com, and I'm going to try to carry that in the IC Network website. If I can get a good price for you guys. Let me see if I can find it. I only found one company, and it was a tub. Yeah, USA lab tested bulk ultra micronized PEA. So PEA is um, not water soluble; it's oil soluble, and it comes in different sizes. The assumption being that a smaller size would be more effective at like passing through tissue, but the research shows that there's really no major difference between the two. There are a lot of companies now that are working with PEA. You'll find lots of different types of PEA out there. Yeah, yeah. I just want to know where it comes from. I'm very uncomfortable buying stuff from Canada. I mean, I'm China. Canada's fine. China's not okay. So, distributed exclusively by elevationterpenes.com and Loma Linda. What? Uh, as a dietary supplement, take 400 milligrams, a quarter teaspoon, 1 to 3 times daily, or directed by a physician. Now, there's a lot of research saying that we need to have resveratrol added to it. So I think the Peora formula that we have is really a solid formula, but if you can't swallow a capsule, then that would probably be the option. Rhonda said, did you try the other one you got in the mail? No, I have not. That's the one that's $300, like almost $400. And I offered to send it back. I just was shocked by the price when they called me last week. I mean, I thought it would be like $70 or $60. Carol says, I'm so sick with the urgency, frequency, and pain. It's very depressing. I haven't been getting dressed or leaving the house unless I have to, and I'm usually very social. The only thing that seems to help, like Azo or Uricalm, but I can't stand that they turn your urine. Hold on. Orange. I went to my doctor recently. She did a lidocaine installation, but they only help for a couple of days. Of course, they want me to come back in a couple of weeks, but I think it's a waste of time. I was somewhat constipated and my urine was so dark. She said I was dehydrated. It's hard to drink water or anything because I already feel like I have to pee without drinking anything. All right, girl. Number one, let me remind everybody here, I don't give medical advice. I'm not your doctor. My job is to be an educator. I want to help you look at it in a different way. I want to give you a different set of questions, and then I want to kick you in the butt and get you back to your doctor to get their answer on that. Because it's not my job to give medical advice. But here's the deal, Carol. If you were a coaching patient or a customer of mine, we would go all the way through your history for a moment because we just want to try to understand anatomy. That urgency, frequency, pain is coming from something. There are 3 sources that it can come from. It can come from the bladder wall itself, it can come from the muscles, and it can come from the nerves. That's it. So we have to try to understand your anatomy a little bit. And so question number 1 is, how old are you? And how old were you when your symptoms began? How old are you now? And how old were you when your symptoms began? We do phenotyping now. We want to try to understand the underlying cause. And there are multiple things that this can be. And you often have clues that will help us try to figure out underlying cause. So the very first thing I usually ask women who call me is, how old are you? And how old were you when your symptoms started? Because if you're over the age of 40, and your symptoms started over the age of 40 or after a hysterectomy or using Lupron for endometriosis, the very first thing we're going to consider is just estrogen atrophy. Think about your bladder for a moment. It's the only organ in the human body designed to hold toxic waste because urine is body waste. So how can the bladder hold body waste, ammonia and urea for hours at a time and not get damaged? Well, it's really an evolutionary marvel because it turns out your bladder is wet on the inside. It has a really thick, robust coating of mucus. It's the mucosal layer, the glycosaminoglycan layer. And that thick moisture is a barrier. It protects the skin. It protects the skin from toxins in your urine, and it protects the skin from bacteria. Unfortunately, it is also estrogen dependent. So when you're young and have lots of estrogen, you got lots of mucus. When you're older, you don't have the estrogen, therefore you don't have the mucus, which means your bladder's ability to defend itself is now compromised. That's not a disease, that's aging. We call that estrogen atrophy or the genitourinary syndrome of menopause. So that's one suspect. You're 64. Okay, excellent. Okay, she's 64 now. She said her symptoms began in her 20s. Okay, so we get to move away from the estrogen atrophy theory. The second thing that we're going to look at is physical injury or trauma. And having a baby is trauma, especially if you've had an episiotomy, if you suffered any muscle tears, et cetera, et cetera. Remember, for some people, IC begins in childhood. For others, it begins after menopause. You have the same diagnosis, but are you physically the same? Of course not. For some people, IC begins after going through chemotherapy, while for others, IC begins like you after having a baby. Are you the same? Absolutely not. You're not the same. The greatest gift that a woman can give a man is to risk his life, her life, to bear his child. Carrying a baby and delivering a baby is trauma. It can be traumatic to the pelvis. It can be traumatic to muscles. It can be traumatic to nerves. And the sad thing is, here in the United States, women who've just had babies are not sent to physical therapy to get their muscles healthy again. In Europe, that's normal. In the United States, our insurance won't pay for that. So the fact that you believe that your symptoms happened after having a baby is a ginormous clue for me. So how was that delivery? Was it a difficult delivery, or did you suffer any injuries to that during that delivery? Can you remember anything? Lisa says, how often do you use your estrogen cream around the urethra? I'm 62 and I had chronic UTI since I was 20. But when I turned 60 is when my IC symptoms really started. So Lisa, you're different from Carol in that, well, you're similar, you're the same age now, but you're in that group of patients. Well, you might be in that group of patients where the quality and health of your skin is the reason why your bladder and your urethra are so sensitive. We have a case study of an 18-year-old who developed IC symptoms, and over a period of a year, they got worse and worse and worse. She was diagnosed with chronic UTI, IC, overactive bladder. Nothing worked. IC meds didn't work. Her symptoms got worse and worse and worse. And finally, somebody said, hey, you didn't by chance start birth control, did you? Yeah, her symptoms started 2 weeks after starting oral birth control for the first time. And the birth control was simply too strong. And it put her into an early menopause. She didn't have enough estrogen. Her bladder wall got thin. And that's why her bladder became so sensitive. Once she stopped the birth control, it took 6 to 8 weeks, her symptoms went away. So the quality and health of your skin is a separate and distinct issue that is very common in women, but also the pelvic floor and injuries to the pelvic floor are very common and more common actually in both men and women who develop symptoms of IC. So they can look at your skin to tell you how dry you are, and they're the ones who should give you instructions on how often you should use it. I use mine two to three times a week. But I'm also rather passive aggressive and I forget to do it for a week or two. And then my urethra starts hurting and I go, oh, yeah, I better use it. You follow your doctor's instructions. Okay. Don't go over the top and start doing more. Ask your doctor to look at your skin and see how healthy it is. I know my skin is in poor shape because my inner labia have reabsorbed, which is what happens as we get older. Some of those the labia are the lips that protect and cover the entrance to the urethra and the vagina, and those inner lips resorb when estrogen levels drop. Mine are pretty much missing now. Not that you needed to know that, but I have no shame. I will use my body as an instructional tool. Carol says, my son was born premature. I was given an episiotomy, but the nurses commented on what a good job the doctor did showing me up. It was at Brigham and Women's Hospital. It's a teaching hospital. So, Carol, there's something that I call the chicken versus the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? They're both involved. They cannot not both be involved because they're too interconnected. So there are some patients whose symptoms begin after a bladder wall trauma, like chemotherapy or drinking too much coffee or soda. The bladder wall gets burned, the bladder wall gets sensitive, it starts to hurt, and the muscles get tight in a guarding reflex. Our therapeutic priority for that patient is to calm and soothe the bladder and to let the bladder wall heal. But that's the smaller group. The far bigger group are the patients who have a muscle trauma. But you don't know you have a muscle trauma. You have no clue. And then one day you get frequency urgency and you call the doctor and you think you have a UTI. The doctor goes, okay, here's some antibiotics. They don't work. Call the doctor back. Doctor puts you on a different antibiotic or long-term antibiotics, but you're still flaring. You go back to the doctor. The doctor goes, oh, maybe you got overactive bladder. Let's try some ditropan or some Detrol. Doesn't work. You're still flaring. Then eventually you get the, oh, I hate to break it to you. I think you have this incurable bladder disease called IC. Remember, we don't talk about IC that way anymore. The IC is more of an injury or trauma. Okay. But most of us were told at one point in time we had an incurable bladder disease. And they gave you a prescription for Elmeron or an antidepressant. They gave you the diet and they sent you on their way and said, okay, we'll see you in 6 months. And you want to get better. So you do everything they tell you to do for 6 months, a year, 2 years, 4 years, 5 years, 10 years, 20 years, 30 years. You think you have a bladder disease, you're doing everything, but you're flaring. That whole time you still flare. Why? Because bladder treatments won't fix the underlying problem. And the underlying problem is an injured pelvic floor restricting blood supply. That's why pelvic floor physical therapy is now the number one recommended treatment for IC in our AUA guideline. 80% of IC patients have tight pelvic floor muscles. And pelvic floor physical therapy, we have yet another study that has compared pelvic floor physical therapy results versus bladder treatment results. Pelvic floor physical therapy outperforms bladder treatments substantially. Why? Because this isn't a bladder disease for a lot of people. Carol says, I was also a bedwetter until I was 11. My mother died when I was 11 and 2 months. And later we had a fire and I had to move my cousin. I stopped peeing the bed because I had to sleep with my cousin. So the odds are, Carol, I mean, there are a couple of different things that I think would be happening for you. You were subconsciously tightening your muscles to avoid having an accident once you were sleeping with your cousin. You're sharing that bed with your cousin. And tight muscles may have become a habit for you. I can remember when I went to UC San Francisco for my second opinion, the doctor asked, were you beaten for bedwetting? And thankfully, I wasn't. I wet the bed a couple of times, like in kindergarten, maybe first grade. But my parents were very gentle. And I learned what to do, and eventually it stopped. But for that child who is beaten, that child basically learns how to tighten their muscles, and then they forget how to relax them. So for those patients, for example, a good example is a patient, a young girl with vaginismus. So you have no idea you have tight muscles. And then you meet a guy, you're 18, 21, you try to have sex and it hurts. Or you hate having a pelvic exam because whenever they put the speculum in, it hurts. Why? Because the muscles are tight. And so our next question is, why would the muscles be tight? Well, there can be trauma, falling on a bicycle seat, landing on a balance beam, crotch first, falling, breaking your tailbone. There can be lots of different traumas in childhood that can leave that patient in a chronic state of muscle tension, which then results in painful sex. And some women literally never know what normal sex feels like because it always hurts them because they've been in tension for so long. And pelvic floor physical therapy transforms them. And we can finally get these muscles back into their proper position. You know, when if you look at these pelvic floor muscles, you can basically see that they're flat. They're at the base of the pelvis. They're out of the way of the uterus and the vagina and the rectum. They stay low. They cradle kind of the pelvic organs. Okay, so their natural position is to be flat. But when they get tight, what happens is they lift. They lift. It's like popping, it's popping your muscle here. If you're making if you're popping your bicep, right? You can see that the muscle lifts. Not that my bicep is not what it used to be. Well, when these pelvic floor muscles get tight, that same exact thing happens. So they lift and they bunch and they start squeezing things they're not supposed to be squeezing. They start interfering with blood supply. They start pressing on nerves. If you have sciatica, you have tight piriformis muscle. That's a slam dunk diagnosis. The sciatica is from a tight muscle squeezing a nerve. So the goal of physical therapy is to get this muscle to release, relax, and get back out of the way of everything. Does that make sense? I hope that makes sense. So, you may have been subconsciously tightening these muscles, and then kind of the straw that broke the camel's back was having the baby. And that was kind of the injury that drove your muscle tension from latent to active, or the trigger points from latent pain-free to active painful. Okay, now seriously, I'm totally confused here, Carol, because your doctor, okay, so remember, multiple potential causes. We are literally peeling an onion to get to the underlying issue of what could be driving your symptoms. So when you were younger and in your 20s, we look at muscle, 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 muscle. But now we have a complicating factor here. And the complicating factor is the bladder is also very estrogen dependent. The bladder needs estrogen to produce that nice thick coating of mucus. And now that you're over the age of 50, you are also in estrogen atrophy. And for those of us who are there, we all know what happens. Things get dry. And dry is bad because if you think about how painful dry mouth is, dry mouth hurts. Honey, dry bladder hurts. Dry urethra really hurts. And so your doctor prescribed you estrogen because your doctor saw that you were in estrogen atrophy, but you're not using it. Why aren't you using it? Because it's not 6 of one, half a dozen of the other. These are both going on. We cannot stop the estrogen line. Aging happens. That's another layer, but that could complicate your bladder health. But the muscle stuff still has to be addressed too. Um, she says, I did go to pelvic floor physical therapy for a while and it seemed to help a little, but I was late for a couple of appointments and canceled some. So they released me. I do have a wand, but I've never used it. Well, girl, it's time to start using stuff. Listen, can you pee on command or are you hesitating? If you can pee like a horse, your pelvic floor is fine. If you have to wait a couple of seconds to start your urine stream or you're stopping and starting, then that tells us that your muscles are probably a bit messed up. And we've got to get these muscles healthy. And if I were you, I would be going back to physical therapy more and have another pelvic floor assessment. Let's see where your pelvic floor muscles are now. And then have them teach you how to use that wand. Don't be afraid of that wand. There's a learning curve. First couple times you use it, you'll have no freaking clue how to use it. And that's why reading about the muscles and learning about muscle position is so incredibly important. And my favorite, the book that really helped me was okay. This is the book that finally helped me understand how my muscles were laid out down there and how to work with them. So again, if you're laying on your back, tailbone down here, you've got muscles to go this way and you've got muscles to go this way. And so with the wand, we go again, if you have a clock, so 12, 6, 7 to 11, 1 to 5. You're going to work on the left and you're going to work on the right. And you don't just poke it in there and just start pushing stuff. That makes no sense. It's very gentle, very soft, and you're just looking for things that hurt. And then it's a gentle massage, kind of back and forth, shallow, deep, shallow, deep. But your physical therapist should be teaching you how to use the wand too. My physical therapist kept saying it's a J shape. I'm like, I don't know how to use this wand. Help me. I do not get it. She's like, it's a J shape. I'm like, I don't understand the J shape. I have no freaking idea what you're saying about a J shape. Here's the J. Here's the J. There's the J's. Only it's kind of like this. So your muscle goes in a J shape like this, and it goes in a J shape like this from the tailbone. But you can't ignore one and focus on the other. You got two separate things going on. You got tight muscles and you're in estrogen atrophy. We all have to focus on the quality and health of our skin. We got to keep our skin down there as healthy as possible. One of the signs of estrogen atrophy is urine burn, where your urine feels really hot. So as you're peeing, does your urine feel super hot, like it's burning you down there? It's not really burning you. It just means your vulva is dry from estrogen atrophy. So urine burn is a sign of estrogen atrophy on the vulva. So anyway, let me get another drink here. You know what I'm drinking this time? I'll show you, is this new me rooibos chai. So rooibos is a brown grain tea that's very friendly to the bladder. And this has some of the spices of chai. It's got cinnamon, ginger, allspice, nutmeg, cardamom, my favorite, because hello, I'm a Swede, and cloves. And I used to love chai tea, but I couldn't do the caffeine. It really tweaked my bladder badly. But I can do this herbal chai. So Numi Rooibos chai is pretty darn good. I do a little bit of sugar and a little bit of cream, and I'm good. Peggy, totally understand, Jill. Going back to therapy this Friday. Good. Yes. Lori, absolutely. Yes. Carol says, no, I'm hesitating. If you're hesitating, that means your muscles are tight. Kim says, it's Chanca Piedra. No, hold on. No, wait a second here. Wait 1 second. Do not just go order stuff if you've got somebody telling you that it works. We got to consider method of action first. Wait, don't do that. We have to think about, what does this do? So let's look it up here. This is how people get scammed, and I don't want you to get scammed. So you're saying it's Chanca Piedra. Okay, let's see what it is. I've never heard of this before. It's a widespread tropical plant commonly found in coastal areas, known by the common names gale of the wind, stormbreaker, or seed under the leaf. Okay, well, what the hell does it do? Hold on. It's used to treat kidney stones. Wait, what the hell? No. Oh, okay. Hold on. It's made with celery. Okay. You know what it is, guys? It's alkaline, and it's designed to help prevent kidney stones. This is not going to help a damaged bladder. Alkalinity is just as bad as acidity. I mean, think about it. Obviously, sulfuric acid is going to burn, but so is bleach. Bleach is alkaline. You know how if you spill bleach on your fingers, it gets all slippery? That's because the bleach is freaking dissolving the skin. Bleach is bad. Alkalinity in any great degree, or acidity in any great degree, is going to damage the bladder wall. So they're using it kind of like pre-leaf to alkalinize the urine, but guys, no. If it's used to treat kidney stones, gallstones, liver disease, and stomach ulcers, not approved by the FDA to treat any condition. It's been studied with kidney stones. There's no scientific research supporting its use for gallstones. It can be used to lower uric acid levels for people with gout. And it had a little tiny bit of effectiveness, little tiny bit with hepatitis B. Safety considerations: should not be used with diabetes, potassium level, heart conditions, and blood clotting disorders. Common side effects: abdominal pain, nausea, blood in the urine. Hello? If a side effect is blood in the urine, why? What's it doing to the bladder to cause the bladder to bleed? Severe side effects may increase the excretion of electrolytes like potassium. Precautions and warning: it's essential that these be used with caution. Blood clotting disorders: Chanca Piedra may slow down blood clotting, increase the risk of bleeding in those with clotting disorders. Chanca may lower blood pressure. It may decrease potassium levels through excretion. Little is known about the effects on pregnancy, children, or people over the age of 65. Speak with a healthcare professional before taking this supplement, especially if you're taking any prescription medications. Honestly, I wouldn't touch that with a 10-foot pole. The only context where that makes sense to me would be Anybody with a bladder wall challenge where urine is irritating the bladder wall through diet. It just doesn't make a lot of sense, guys. And specifically, if you're over 65, they don't want you to use it. You know, listen, the thing is, at least Lisa says, according to WebMD, it's been traditionally used for kidney stones. It's thought that it might, emphasis on might, relieve spasms and increase urine. It's also thought to have activity against bacteria and viruses. This is from WebMD. Yeah, but the data is poor. It's poor. Listen, I obviously it's important that we consider every option, but we want to make sure we don't do any harm. I mean, we've got supplements that have been tested specifically in IC patients where there's research supporting their use. So, um, I use something called the Oxford Scale of Evidence-Based Medicine. I started using this 25 years ago when I built the IC network because I had a lot of people saying, "Hey, this will fix it, or that'll fix it, or this will fix it, or that'll fix it." And remember, my degree is in drug development pharmacology, so I like science. I'm not going to let you advertise using a magnet to cure IC on our website. Period. End of story. Not going to happen. And I had a lot of people pretending to be sales reps in the ICN support forum for many, many years, well before social networking and stuff. And we caught them all the time pretending to be patients trying to sell stuff. And I was talking with Tony Buffington, who's IC research, was the one of the big original IC researchers. He was at Ohio State. And I was doing a woe is me. I can't make anybody happy. Everybody's mad at me because I'm saying no, and they're saying I'm censoring them and all this sort of stuff. And he turned me on to the Oxford Scale of Evidence-Based Medicine. He said, use this, use this. This will help you rate the information completely neutrally. So it's from A to F. And F, the least reliable information for you to base a medical decision on. And F is from a company selling you something because they get a financial benefit from it, or from another patient who has no medical background. That's an F. A D is in dog, is the opinion of one doctor or somebody who's very, very experienced. So I'm a D. I'm not an F. I'm a D. A C is a preliminary study, a B is a better study, and an A is a double-blind placebo-controlled study. So when we think about how precious our dollars are right now, and we've got to stretch our dollars, are we going to put our money into something that is completely untested versus something where we have proof that this can be helpful? Because so many patients were buying hundreds and hundreds of dollars of all sorts of crazy supplements and Chinese herbs, and they weren't getting better. And so I use the Oxford Scale of Evidence-Based Medicine when anybody contacts me. And for companies to contact me, it's like, show me the research, hon. Show me the research. Your opinion is not enough for me. I want to see a research study. Anything that validates and proves that what you're saying, that this could help IC, is real. So I don't jump on bandwagons like that at all. I just don't. Do no harm. And we don't know if it's harmful. Peggy says, I can't do chondroitin or glucosamine. It causes diarrhea. Well, how about Allopath? What does that have in it? Allopath has aloe and PEA, and let me look. I mean, there are just so many people out there trying to make a quick buck, and they're fly-by-night companies. They're here for 2 years and then they're gone, never to appear again, and they're just making crazy claims. Allopath has calcium carbonate, magnesium, organic aloe vera, PEA, L-arginine, and quercetin. And it's in a vegetable capsule with a palm oil extract. I'm very happy that we have supplements, because if we didn't have supplements, we would virtually have nothing at this point in time for the bladder wall. Now that Elmeron, is known to cause issues. So pretty much we got bladder installations and we've got supplements at this point in time. And we're hoping that we can get more companies to take more of an interest, but it's hard. Marlia, thank you, Jill. That's why we look to you to clarify information of all this internet BS. Yeah. Diane says, what about all natural alkaline water like Evermore, which says it's 8.8 pH due to filtering through lava rock? Is that okay to use when brewing coffee? I don't think it is, honey. I don't think it is. I mean, I can remember I went to, I used to go to a lot of food shows looking for low acid food, because we used to sell a lot of food on the IC Network shop. We still sell some, not a lot. And I can remember the first time I tried alkaline water, it was in San Francisco at the Fancy Food Show. And I swallowed it, and instantly all the saliva in my mouth disappeared. Just completely dried it out. I was shocked. And my mouth was so sore for like a half an hour to an hour until it made more mucus. 8.8 is alkaline. Your normal pH for your urine is going to be, well, it starts a little bit more acidic in the morning. It's a little bit more acidic in the morning, and then it slowly gets more neutral as the day goes on, or I might have that backwards. You want to be in the 7 area. 7 is pH neutral. Spring water is perfect. And, now listen, if you're in a bladder wall flare because you drank coffee, now your bladder's screaming and we need to alkalinize your urine, then yeah, I would have a half a cup or a quarter cup of an alkaline water, or you can take some pre-leaf or some Tums. But you want to follow that up with water, normal water. It just doesn't make any sense to keep putting a diluted bleach on a wounded bladder. That's going to cause damage, just like a diluted acid would cause damage. Our goal is to try to be pH neutral. Spring water is going to be the most pH neutral. Peggy, it's on our website right now. I hope that makes sense. There was a company that was trying to sell a low acid coffee to the IC world about 15, 20 years ago. And the way they made low acid coffee is they took a traditional coffee bean and they coated it with sodium hydroxide. And sodium hydroxide is very alkaline. It's actually extremely alkaline. And it's like, wait. You're telling patients to drink regular coffee with just sodium hydroxide in it? That's rather aggressive, don't you think? And they were very much of the opinion that the reason why people were sick is because their body was acidic, which is really laughable, because the pH in your bloodstream is controlled to the hundredth, thousandths of a what's a word? I forget the word. The pH in your bloodstream is not going to change substantially. It's always going to stay in a very, very specific range, and it's a very tight range. And if it strays up into the acidic or alkaline, you basically die. That's a very, very sick person. And making this entire industry by telling people that their body's acidic when their body is not acidic at all. It's just a marketing pitch. The pH hasn't changed. Now, if you're drinking, if you have a wounded bladder and you're drinking acidic cranberry juice or orange juice, you're pouring acid directly on the wounds in your bladder. That's going to hurt like hell. That's when you alkalinize. Then, that's when that quarter teaspoon of a baking soda in a glass of water or a cup of sucking on some Tums or some pre-leaf, that's the only context that makes any sense for using alkalinity, in my opinion. Diane says, but the low acid coffee pH is around 5.4. So if you brew it with natural alkaline water, wouldn't that bring it closer to, no, you're not looking at it right, honey. Diane, pH in coffee is determined in 3 ways. It's determined by the altitude that the coffee bean is grown at. The higher the altitude, the higher the pH. No, the higher the acidity. The lower the altitude, the better the acidity. So that's the first place that acidity in the coffee bean is controlled. The second place that acidity is controlled is in how it's roasted. Acid is generated when that coffee bean hits hot metal. It causes a specific type of acid to develop. And it's called, what's the name of the acid? Chlorogenic acid, maybe. And so those big companies that do a lot of coffee, they roast them in hot metal drums. And it's the contact of the bean on the hot metal that produces chlorogenic acid. And then the third way that the acidity is controlled is by how you roast it. If you roast it in hot water, that's going to extract more acid from the bean. But if you use a cold brew process, that's going to extract less acid from the bean itself. So the truest way to get a low acid cup of coffee is to use a low acid bean like Bella Rosa. Bella Rosa, the coffee company Bella Rosa, has the lowest levels of chlorogenic acid in the industry. And that was tested at UC Davis. That's why we sell Bella Rosa coffee, but we also sell Tyler's coffee, and I think we're going to discontinue Simpatico. But you take the Bella Rosa true low acid coffee, it's roasted in an air popper that they custom developed, and then you cold brew it. That's perfect. And then if it's still a little bit bothersome, then you take a pre-leaf. 2 caplets of pre-leaf will reduce 95% of any residual acids. Tyler's No Acid Coffee recommends brewing with naturally alkaline water to make it a neutral beverage. I haven't talked to Tyler in a long time. I know that they just asked me this week to do a blast email for them. I will ask them about that. I'm referring to the only low acid coffee study that I found on the internet when I was researching it several years ago. And it was a coffee review company, and they took samples of all the coffees that were marketed as low acid coffees, and they brewed them and they tested the pH and then they ranked them. And Tyler's coffee, I know he says no acid, but Tyler's coffee still has a little bit of acid because it roasted at about 6.2. It was not pH neutral. And I talked to him about that. It's a pretty bold statement. So they have it on their website. Okay. would be very I mean, I'm just thinking in my brain, what would what I mean, I'm just trying to think of the mechanism of what that would accomplish. I guess the proof is in the pH test. Brew a cup of coffee in naturally alkaline water, and let's see what the pH is. I don't know. I don't know. I don't think you can cumulatively add up the pH levels the way you're doing that. I don't know. All I know is I looked at the research from UC Davis, and it impressed the hell out of me. Marlia said, "Will Prelay for Tums cause kidney stones? My doctor said to take Tums for bone building calcium, which I'm all for, but I did pass 2 small kidney stones in the past." Well, I mean, number one, they normally identify the type of kidney stone you have. One of the more popular types of kidney stones are oxalate-based kidney stones. And so generally when you have that type of kidney stone, they ask you to reduce foods that contain a lot of oxalates. Things like almond milk. Almonds have a lot of oxalates. Chocolate have a lot of oxalates. So Marlia, you really have to have them identify the type of kidney stone you had. And of course, you never take pre-leaf or anything like that like candy. Some people get into the habit of taking two every time they eat, even if they're not eating anything acidic. And that is, in my opinion, a mistake. You only use it when you need to use it. Don't eat any of these supplements like candy. Consideria said, "Not sure what time it is there. Can I still call you tonight since I'm having a flare?" It is 3:35 now. We're getting close to the end. I think we're getting close to the end now. So you had oxalate stones. Okay, so didn't they tell you to remove the oxalates? I mean, look first to the dietary restrictions that they gave you. What was so interesting is when almond milk became very popular, one of the things that started happening is people started getting more kidney stones. Why? Because they were eating a lot more oxalates than normal. And so that would be one of the very first things that they would normally have you look at is, are you eating foods that are pretty high in oxalate? Um, yeah. All right, guys. Well, listen, we've been going now for 3 hours. So, I'm here as long as you have questions, but I'm also trying to protect my voice. So let me just do a last call for questions. Last call for questions. Okay, Marlia says, "No, nothing. I do the research on my own, but the nephrologist offered nothing. I research it to learn." So Google high oxalate foods. Okay, high oxalate foods. All right, guys. Well, listen, I'm gonna let Sudaria call me. I'm gonna put my phone in here right now. That's my phone number. Give me 2 minutes. Let me shut down the stream, okay? And then you can call. So here's your homework for 15 minutes a day. I need you to do something for your muscles. Get out, relax, do your pelvic floor work if you need to do that. Let's move that body a little bit. Number two, I want you to look at your diet. Let's make sure you're not accidentally shooting yourself in the bladder if you happen to be a bladder wall patient by poor choices with food. It doesn't mean you'll never be able to have coffee again. It does mean that right now your bladder is not happy with you. It's injured. So let's create an environment to support healing. For 15 minutes a day, I'd really love it if you could do something that would be calming to your nervous system. Do some good mind-body medicine, some good deep breathing, meditation, guided relaxations. The IC Network has great guided relaxations on our website for pelvic pain that are free. You can just dive in there, turn them on, and do it. And last but not least, for at least 15 minutes a day, preferably an hour a day, I want you to laugh. Do fun things. Because when you laugh, that reduces pain. Your brain goes, hey, she's laughing, therefore her life must not be at stake. And it will actually start to calm pain down. So let's get in there and try to improve your state of mind a little bit. Let's do some fun things. Thank you, Michelle. I feel pretty good today. I started new blood pressure medicine. I'm quite happy with it because I can see that my veins are not all funky. It's been a journey having a new diagnosis, but it is what it is. It's hereditary in my case. So, all right, guys, I'm going to say goodbye to Facebook right now. As always, you're always welcome to give me a phone call. Just please be patient. Make sure you leave your name and number when you call the IC Network, and I will call you back when I can. And of course, if you like these meetings, please become a member of the IC Network or buy something in our store because that's what keeps me doing this. We do have bills to pay, so your support is very encouraged. Okay? All right, goodbye, Facebook. All right, Facebook is shut down. I gotta stop that. I gotta stop that. All right, YouTube, y'all be well. Have a good week. I want you to have a fantastic week. Get out and enjoy the sunshine while you can. Okay? I'll see you later. All right, Serteria, go ahead. You can call now.